Thank you for your participation towards APICON 2022. I am Dr. Suranjana Basak. I am a consultant physician and endocrinologist at Reliance Hospital in Navi Mumbai. I was also the CIDCO NMMC, the Navi Mumbai Municipal Corporation's COVID ICU in charge for the last 2 years. So my talk was very much relevant towards the ongoing pandemic that made everyone's lives a living hell. So COVID-19 complications or post-COVID-19 complications such as the pulmonary complications that we have like ILD, bronchiectasis, post-COVID sequelae, COPD or oxygen dependency. These are all concerns of these are all areas of concern that deteriorate the quality of life that people may be having post-COVID. And we all know at least one person in our families, if not more than that, who've suffered through COVID in a very, very bad way that has left a very devastating quality of life after that. We've all been seeing a lot of post-COVID patients such as who keep presenting with us with the complaints of cough, cold, dyspnea. So these are certain things which needed to be addressed, and since we don't have a lot of medicines that can do that, even though there are newer molecules that are coming up every day, I devised a very cost-effective manner to tackle this issue. So the cost-effective manner is such that it's called the COVID-19 pulmonary rehabilitation therapy, which takes about 2 to 3 hours, a total of 6 sessions every alternate day immediately after the patient is discharged, wherein you go ahead with an intensive therapy, physiotherapy for 15 minutes, after which you go ahead with a 5 to 10 minutes of nebulization with Duolin, Burecort, Furacort, whichever one is necessary for you according to you at that point of time, followed by 2 hours or 90 minutes of high flow oxygen therapy of 10 to 12 liters. This not just improves the bronchodilation of the lungs, it improves the respiration, it improves the aerobic circulation, it improves the overall complacency of a patient. So they are not, you wouldn't want to see that your patients are just living and fine. You would want to see them breathe properly, you would want to see them living a very stress-free life, not roaming around with the oxygen cylinders. So this particularly did not take a lot of effort because it just needed a bit of regular monitoring, ensuring that 6-minute walk tests are done, a post and pre chest x-rays are done, and the reports that were visibly seen, as you could have seen in the talk. So I would recommend that we go ahead improving or trying to devise methods to improve the quality of life, particularly after such pandemic or after such havoc, and not just focus on treating the illness itself, but more about reducing the complications that a person may have. So thank you very much. I hope it was a good take-home message that you could try and implement. For those who have attended the talk, they would know the kind of results that were visibly seen with x-rays and 6-minute walk tests and an improvement in saturation levels. So, and this is very, very cost effective. It can be done on an OPD basis. So I would highly recommend everyone to go ahead and try it out at their respective centers. Thank you very much.